Hey, everybody. Thanks for tuning in. I do appreciate you taking time out of your day. Hope everybody's having a great day. And today we're going to talk about something that affects so many of you, and you don't know what to do about it. And that's exhaustion. Are you burned out? Do you have a lot of excessive stress? And if you do, what do you do about it? So, we're going to talk about some ways that you can find out if you're overstressed, because so many times you go, I'm fine, there's not a problem for me. And in reality, you're really burning yourself out. And this becomes a big issue in our society because everybody's doing 5 and 6 and 7 different things at a time. And if you do let that go for a long period of time, it's going to cause a bunch of problems. Now, your body has a lot of warning signs to let you know the level of stress that you're under and is it sustainable or not. And if it's not sustainable, you're going to crash. So we need to deal with that. So being under a constant barrage of stressful situations without allowing time to restore and recover can really cause you to burn out. And if you burn out, that becomes a real serious issue because one of the things that happens is your immune system will burn out if you're stressed out. And when that happens, now we're allowing ourselves to get things like colds and flu, but also more serious diseases. Cancer, heart disease, high blood pressure, all of this can occur if you're just stressed out. And so we've got to be real careful to look for the warning signs and then do the right thing. So if you're experiencing any of the symptoms we're going to talk about, you really want to investigate what you're doing, what is your stress management plans, and if you can remove some of the stressors. We're going to cover the 10 top warning signs if your body is burned out or not, and then what we need to do to fix it. Difficulty waking up in the morning. Now, there's a hormone called cortisol. We're going to talk about this a lot today. Cortisol is a hormone. It's released from your adrenal glands, and the hormone is necessary for stimulating your energy levels when you wake up in the morning. It can be lacking during excessive long-term stress and burnout. So one of the things we can do, and we do this at our office, we can do a saliva test, and we can test your cortisol levels. Is your cortisol too high, or is your cortisol too low? If it's high, that means you're in a stressful situation, and you need to do something about it because you're putting a major strain on your adrenal glands. Your adrenal glands produce energy. They produce adrenaline. They produce something called pregnenolone, which becomes DHEA, which becomes your sex hormones, or if you're under stress, becomes cortisol. They also produce prostaglandins, and prostaglandins mediate inflammation, and inflammation is a key if you're burning out. So we've got to get the inflammation under control. And so the adrenal glands do a lot of things. They're real small little glands. They sit on top of your kidneys. They're about the size of a walnut. And they're so overlooked and ignored when it comes to healthcare. So we're going to talk a lot about the adrenals today, too. So again, they control hormones. They can give you energy, and they control inflammation. But they produce this cortisol, which can be good. Like in the morning when you wake up, it's the stress hormone to kind of get you started. But too much of it can be a real serious issue. Do you get tired? Even though you're getting enough sleep. How many people have that? Raise your hands. A lot of you, I know you do because you come into my offices and you tell me every single day, Doc, I'm sleeping 8, 10, 12 hours. I'm still exhausted. Well, let's do something about that. So if you need rest and recovery after you rested and recovered, like people always say, I need a vacation from my vacation, you end up feeling tired all the time, that becomes a serious issue. Now, it could be a chemical problem, could be what you're eating. It could be some chemicals you're exposing yourself to. For example, if you drive in traffic, let's say Atlanta traffic, for example, or Los Angeles traffic, you're sitting in a lot of traffic, I guess any city really, and you're absorbing a lot of carbon monoxide. Carbon monoxide gets into your body and it clings on to your red blood cells, and it prevents your red blood cells from carrying oxygen. And so you get tired. So your commute to work, sitting in traffic, could be one of the reasons why you're so tired, because you're inhaling all this toxic carbon monoxide poisoning. And then you try to sleep, but you're still not getting enough oxygen. So oxygen is one of the keys, and most of us don't even sleep enough, and that's breathe properly, and that's a problem. Now, another problem is you're not breathing when you're sleeping. How many people have that? Sleep apnea? Raise your hands. How many people snore? Raise your hands. Folks, I'm on the radio. I really can't see you raise your hands, okay? So you really don't have to do that. Snoring, sleep apnea, burping, gas, bloating, chronic sinus problems, chronic cough. This could be a sign that your stomach is pushing up into your diaphragm. And if the stomach pushes up into the diaphragm, you might have a condition called acid reflux. And the reason it's worse when you sleep is because when you're standing up, you have gravity pulling your stomach down. But when you lay down, you don't have gravity. And so the stomach can prevent your diaphragm from dropping down, allowing you to get enough oxygen in. And that could lead to things like sleep apnea. So we've got to get the digestive system working, pulling the stomach down away from the diaphragm so that you can breathe again. And that's why if you study any of the stress-related techniques, meditation, yoga, tai chi, very big into breathing because most of us don't breathe properly, and that can lead to burnout. Another thing, and this is kind of interesting too, you're craving salty foods. Chronic stress can lead to electrolyte imbalances, which can cause some people to crave a lot of salt. Now, electrolytes are important because they make your body work. Sodium, for example, is an electrolyte. Potassium is an electrolyte. Chlorine is an electrolyte. And so you might see commercials for drinking these sports drinks to replace your electrolytes. When we come back, we're going to talk about better ways to replace your electrolytes. Folks, I'm going to open up the lines. If you have a healthcare question, give us a call. The number is 844-44-DR-JOE, D-R-J-O-E, 844-44-DR-JOE. My website for more information, archived radio shows. You have questions, send me through the website, drjoeesposito.com, or just Google Dr. Joe, because with a number. I am so happy that you're spending a little time with me today, and we're talking today, asking a question actually. Are you burned out? You just stressed yourself out, you're burned out, your body just can't function anymore, and do you even know what that looks like? Because sometimes it's insidious. It happens real slow, and you're thinking, well, I'm just a little tired today, or I just didn't get enough sleep today, or the kids kept me up. And one thing leads to another, and then you realize, or you may not realize, you're just exhausted. And then you turn to stimulants. You start doing things like coffee. That's the big one, of course. Now, what happens with coffee, let me explain this to you, Lucy. What happens with coffee is you have a chemical in your brain called adenosine. And adenosine is released in your brain and gets absorbed in your brain in what's called adenosine receptor sites. It gets picked up, and it makes you tired. Now, it's important you have adenosine because you're supposed to get tired. Well, what happens is you drink coffee, and caffeine looks like adenosine. So it kind of blocks up your adenosine receptor sites, and now your body can't absorb the adenosine, so you don't get tired. So coffee doesn't really give you energy. It kind of prevents you from getting tired. Does that make sense? Yeah. So you drink that, you block up the adenosine receptor sites. Now, your body's smarter than you, and your body says, wait a minute, I need to rest. Let's make more adenosine receptor sites. And so you make more adenosine receptor sites, and now you have to drink more coffee to block up those extra adenosine receptor sites. And that's why when you come off the coffee, you get a headache. A lot of people do. In my first book, it's called Eating Right for the Health of It. I have a chapter on that called Kicking the Habit. And the way to come off your caffeine addiction, whether it's soda or coffee or whatever it is, chocolate, I want you to, let's say it's coffee, put a cup of coffee in front of you. This is in my book, so I'm going to give you a little sneak peek into the first book, Eating Right for the Health of It. And take 2 tablespoons of coffee every hour. You can do 1 tablespoon, but sometimes you got to start with 2. And that's going to give you just enough caffeine to kind of get you going into the next hour and the next hour. And eventually, if you do this every day, you should be able to kick your coffee habit in about 3 or 4 days. It really works. Now, don't put cream and sugar and artificial sweeteners and whipped cream. And no, this is just medicinal. Tablespoon or 2 of coffee every hour. I think you'll be pretty impressed as to how quickly you can come off your coffee. Because long term, the coffee is an acid. And when you put acid in your body, it robs the body of calcium. It probably is one of the most, if not the most, sprayed foods that you're exposing yourself to. And I say sprayed, pesticides, herbicides, chemicals. So you're absorbing a lot of chemicals when you drink coffee. It's an irritant to the bowels, so you may not be absorbing your nutrients properly. Some people say, I got to have my cup of coffee to go to the bathroom. But in reality, that can be causing problems because you're passing nutrients through your body too quickly. It's also diuretic, makes you pee, which can lead to dehydration. And so many of you out there are dehydrated, and you don't even know it. Let's go to calls now. If you have a question, 844-44-DR-JOE, D-R-J-O-E, 844-44-DR-JOE. Ben, how can we make your day better today?
Hi, Dr. Joe. My wife is 24 weeks pregnant, and usually in the second trimester she wasn't very exhausted, but she's extremely exhausted this pregnancy.
Okay.
She has one child who's about almost 2 years old that she takes care of during the day, and she even feels like she just struggles to do housework on top of that. Do you have any tips
Oh, yeah.
or anything like that?
Absolutely. No, that's a real common question. First of all, I hope she's getting her blood work done. If she's low in iron, we got to get her on a good iron supplement. Now, be careful. Go ahead. Be careful with iron supplements because there's two types: plant-based and animal-based. The animal-based or the synthetic version, many times, or sometimes you use iron like rocks or something like that, can cause a lot of constipation. And as a pregnant woman, that's the last thing she needs. So I'd get a plant-based iron. Now, Dr. Joe's Super Greens and Dr. Joe's Essential Source, those are two products. I talk about them a lot on the shows, loaded with good sources of plant-based iron. So that's what I do for my energy is I take Super Greens and Essential Source. Make sure she's drinking enough water because it's not just her she's supplying fluid for, it's the baby. And so many times fatigue comes from dehydration. And then make sure the bowels are moving 2 to 3 times a day. If she's got any type of constipation, that can cause a lot of fatigue. And if that doesn't work, getting the Super Greens, the Essential Source, drinking water, and getting the bowels moving, it could be an adrenal issue, which we're going to get to. We kind of covered it a little bit earlier, and then we can talk about some supplements for her. But I'd rather try the basic stuff first, and then we can do adrenal supplements after that. So try that for a week, Ben, and you're not too far from my offices. Give me a call if that doesn't work, and we'll take it to the next level for you.
Oh, sounds nice. All right. Thanks, Dr.
Thanks
Joe.
so much. I appreciate the call. And, folks, if you have a question, anything on healthcare, 844-44-DR-JOE, 844-44-DRJOE. And we're talking today about, are you just burned out? What are some of the signs and symptoms that you may be experiencing that you're just exhausted and you don't even know it? One of the things, and this is important to realize too, we've probably all been here, is your inability to handle stressful situation. If you're experiencing prolonged stress, your tolerance and resilience for other stressful situations can be somewhat limited. So you just kind of fly off the handle pretty easily. And that could be a sign that you just burned out. And sometimes you need to reboot. And that's a tough thing to do. Patients come to me all the time. I say, Dr. Joe, I just can't take time off work. I can't take time away from my family. I understand that. But sometimes you have to. You have to shut down in order to, power back up again. And when I say shut down, it depends what you do to shut down. What is it? Maybe you just want an afternoon alone where you can sit and watch TV. Maybe you like cleaning the house and your house is a mess and you haven't gotten to that yet. Maybe the kids are going nuts. Find a friend. Find somebody who can help you. And I know especially parenting can be exhausting. You can say, listen, man, I just want you to take my kid for a couple hours. And most friends will be more than happy to do that. And especially single friends. I'm going to give you a little hint here. Ask your single friends because they don't have kids and they think they're cute. And they'll take the kids for a couple hours and take them out and spend a couple of bucks on them and go, man, that was great. I got to take you home now. Bye. So it might be a source that you're not even thinking about where somebody could help you. And you know what? You're helping them too. They're going to enjoy some time with your kids. Your kids probably need a break from you too. They want to get away from you sometimes. And I think it's important that children see a healthy male-female relationship, a healthy male-male relationship, and a healthy female-female relationship. So they know what that looks like. So you can see, if you take a kid out, if you're a guy, take him out with your friends, and you and your friends are having a good time together, okay, that's what a healthy male-male relationships look like. A woman, she can see you with some of your girlfriends. That's a healthy female-female relationship. And the reason I say that is because I find that people, when I talk to them, if they've had a healthy upbringing, their life is a lot easier to deal with. So you might be getting a break and giving your kids an education by letting them hang out with somebody who you trust, of course. So if you're having trouble handling stressful situation, work, home, you might want to consider something's wrong. Now, what happens is, let me cover the adrenal glands again so I can discuss it for Ben who just called. Oh, but if you have a question, give us a call for 844-44-DR-JOE, 844-44-DRJOE. And your adrenal glands produce adrenaline. They also produce something called pregnenolone. Pregnenolone becomes DHEA, which becomes your sex hormones. If you're under stress, they don't become sex hormones. They become cortisol, sometimes good, sometimes bad. Folks, got to go to break. My website, drjoeesposito.com. We archive radio shows there. We have videos of lectures that I've done. Come out to my live events. They're a lot of fun. Most of them are free. Check my website for that. My new book is out, Prescription for Extreme Health. You can get it there as well. And if you want to make an appointment to come see us, drjoeesposito.com. Hey, folks, got to go to a break. Tell your friends about the show. We'll be right back. Thanks for being here today. Glad you could make it. We're talking today about, are you burned out? Have you just stressed yourself out to the point where the body is just starting to go into exhaustion? And one of the problems with that is you really blow out your immune system. When you blow out your immune system, you're susceptible to a lot more conditions, cold, flu, serious diseases, and also speeds up the aging process. And kind of that's how we win the game, isn't it? We live longer than everybody else. And so we want to be able to give you all the tools that you need to get well and stay well. Now, I'm a chiropractor. I'm board certified in chiropractic orthopedics, double board certified in nutrition, BS in nutrition, retired dietitian. My first book was an award winner, Eating Right for the Health of It. My new book just came out, Prescription for Extreme Health. Really good book, by the way. You really should get a copy of that. And so the 32 years of practice give me the tools I need to share with you on how to get well and stay well, because I really want to keep you well. And one of the biggest complaints I get is I'm tired all the time, and I don't know what to do about it. Now, another thing I see often in my practice, and we oftentimes have to try to get to the core of this, is irregular menstrual cycles and bad PMS. Now, the body prioritizes stress hormones over sex hormones. Now, I kind of touched on that a second ago, but your adrenal glands produce pregnenolone. Pregnenolone becomes DHEA, and if you're under stress, the DHEA becomes cortisol, which is your stress hormone. If you're not under stress, then your body's able to make sex hormones. And so with mood swings, loss of sex drive, fatigue, this all can be signs that your body is not producing the right amount of testosterone, estrogen, progesterone, and the other sex hormones. And that can cause irregular periods, painful periods, loss of sex drive, loss of libido, function, I guess I'm trying to get at here, because it is a family show, trying to keep it clean, for men and women. So many times you just burned out your adrenal glands and you're not producing the right amount of hormones, and that becomes a big issue. And you could even lead to things like infertility. So we have three types of stress, chemical, emotional, and physical. Now, chemical stress is what you eat, food, drugs, alcohol, environmental toxins. So when patients come into our offices, I like to sit down with my patients, or we can do it over the phone too if you don't live within the areas where my offices are, and we'll do an evaluation with you. And I want to look at the chemistry and see what you're putting in your body, and then see if there's any supplements that might help. Physically is if a bone moves out of place, if a muscle spasms, you can pinch a nerve. And if you pinch a nerve, it hurts. But 90% of your nerves don't feel pain. Let me say that again. 90% of your nerves don't feel pain. You don't feel your liver and your spleen and your thyroid and your blood pressure and your kidneys, your adrenal glands. So we, in our offices, check the nerves that feel pain, and we check the nerves that don't feel pain, because you can have a pinched nerve and not know it. And then my third concern, if bones are out of alignment, is arthritis. Bones rub up against each other and they wear out. Every single day in my practices, 32 years now, patients come in and say, "Doc, I have arthritis. I've been diagnosed with arthritis." And I ask them the same question. I said, "Anybody ever tell you why you have arthritis?" And the answer is always a resounding no. No one ever explained why I have it. I just have it. Osteoarthritis occurs when bones are out of alignment, rubbing up against each other, and the discs or the cartilage in between the bones wear out. That's called osteoarthritis. And as a chiropractor, one of my main goals is to find out what bones are out of place. And Sean, I'm going to get to you in a second, a question about feet. If bones are out of alignment, we rub up against the bones above and below it and wear out. And so from a structural standpoint, the best treatment for osteoarthritis is put the bones back in place. In fact, the only treatment that's actually going to do anything about it. If you have a healthcare question, folks, give us a call, 844-44-DR-JOE, 844-44-DRJOE. Sean, give us your question.
Yes, sir. Thank you. Love your show. Thanks for taking my call.
Well, thanks for listening. I appreciate it.
I work on concrete all day long, 8 hours a day.
Ooh, ow.
I'm fighting. I'm doing the plantar fasciitis fight of trying to find the right shoes.
Oh, yeah.
Doing the treatments, the stretches, the ice, and stuff like that. But I'm wondering, is there any kind of supplement I can take that will help with the inflammation?
There's a lot of things you can take, actually. Number one, you want to avoid certain foods, because certain foods cause inflammation, sugar being the biggest one by far. So when I
already there.
Okay, yep. Good. So breads, cookies, cakes, donuts, pastas, got to stay away from that. But alcohol really is a sugar. Meats, dairy products, coffee, soda, artificial sweetener, they can all cause inflammation. I call them the 7 deadly sins of nutrition. So you got to cut out those. Now, as far as an anti-inflammatory food, Dr. Joe's Super Greens and Dr. Joe's Essential Source, they should be taken by everybody, because it's loaded with vitamins, minerals, and nutrients. Yeah, I sit right here in front of me in the studio, and that's a great anti-inflammatory. You can also add turmeric.
I was going to ask you if turmeric with a piperine added to it was a good thing.
Yes, turmeric is great if you add pepperine, it's called, which is basically black pepper. It's about 1,000 times more effective if you add the black pepper to the turmeric. So good for you for knowing these big words. Very impressive there, Sean. Yeah.
I do my research, and I've been into healthy living for a while now. I've been living clean for a couple of years now, but unfortunately, I love your show. I always hoped I'd never have a reason to call you, but here I am. So
well, I'm glad you did. Now, the other thing with plantar fasciitis is usually one or more of the foot bones have come out of place. So you have, we adjust feet all day, every day in my offices. You got to put the foot bones back in place and get them moving again to take the stress off the plantar fascia, so it stops inflaming. Yeah.
I'll have it come. Like right now, it's getting really bad. It's starting to I hope it doesn't ruin my career, but it comes and it goes every few weeks or so. Does that make sense?
It could, yeah, because it's different stresses. But you want to consider the structural aspect of that. I think you'll be real happy if you get those foot bones put back in place.
All right.
Great, man. Thanks for the call. I appreciate it.
Thanks.
Folks, if you have a healthcare question, 844-44-Dr. Joe, DRJOE. My website, if you want to order supplements, order my book, send me questions, drjoeesposito.com, or just Google Dr. Joe. Also, like me on Facebook, Facebook.com/Dr. Joe Esposito. And we send out a lot of good information there as well. We want to be your doctors. We really do. And give us that opportunity. I think you'll be really happy with that decision. Lines are open, 844-44-Dr. Joe or drjoeesposito.com. Talk to you soon. Esposito.com. Hey, thanks for listening. I appreciate you taking time out of your day to be with me. And we're talking today, or actually asking the question and then answering it, are you burned out? You just burned out your adrenal glands, you wiped out your immune system, and you may be on a highway to hell, as the song once said, and you've got to take care of yourself for that. Because if you are burned out, there's certain things you need to do to get them fixed. And one of the things we talked about is the immune system, but you have a lot of frequent colds and flu, and it's taking longer and longer for you to recover, that could be a sign. So it's kind of like hormonal imbalances. The body prioritizes stress hormones over immune function, making it harder to fight your colds and your flu. So once again, when your body gets stressed out, you have those little adrenal glands, those little glands that sit on top of your kidneys, and they produce adrenaline, and they produce DHEA, which becomes your sex hormones, or your cortisol, your stress hormone. And we can do a saliva test at our office, and we can test to see where you are. Do you have too much or too little saliva, cortisol in your saliva? And then what we need to do to get that balanced out. So if you're having a real tough time getting over colds and flu, that could be a sign you're blowing out your immune system. Now, the other thing, in my new book, Prescription for Extreme Health, we talk about this, that if you have a can of soda, you have things in your body called white blood cells. And white blood cells fight off infection. And if one white blood cell can kill about 14 pathogens, viruses, germs, bacteria, before it dies. Can of soda, one can. That same white blood cell now can kill about one virus, germ, or bacteria before it dies. So you're really blowing out your immune system terribly by eating sugar. And the worst time when we eat the most sugar is usually in the winter months, and that's when we really should be doing it the least. The other thing to keep your immune system strong is make sure you're getting enough vitamin D. You need I'm about 200 pounds, 195 pounds. I take about 5,000 international units of vitamin D. It's one capsule. It's no big deal. But make sure it's vitamin D3, not vitamin D2. Okay, lots of callers. If you have a question, 844-44-Dr. Joe. Ricardo, how can we make your day better?
Hi. I was listening to your special, and there's a lot of stuff you said that's really interesting. And I'm a person that works overnight.
Oh, yeah.
And like you said, I feel stressed out. I feel tired all the time during the day. I wake up, but I always want to go back to sleep. So I was trying to see, by not losing my job, how can I actually be better energetic, if you know what I mean?
That's actually an excellent question, Ricardo, because I work in radio here, and, of course, a lot of us folks here do work. I mean, radio is on 24 hours a day. So a couple of things. You have to make your day your special day. Like if we go, most people go to bed at 10 o'clock at night, wake up at 8 o'clock in the morning, whatever, 6 o'clock in the morning. You have to decide when is your morning, when is your evening, and when is your night. So sleeping during the day, you want to make the room totally dark because you got to trick your body into thinking it's nighttime. So get some blackout shades. If you have to, get an eye mask to cover up your eyes to black out as much light as possible. And that's going to be a key. And then be careful on the weekends because you're going to try shifting back to normal hours and then shifting back to your hours again. It's really tricky. Someone like you, absolutely no sugar. And that's breads, cookies, cakes, donuts, and pastas. That's real bad stuff. And you want to make sure you're giving your body all the nutrients it needs. So I would start with Dr. Joe's Super Greens and Dr. Joe's Essential Source because I think everybody should be taking that. And if you're having trouble sleeping, it could be a digestive problem. Now follow me on this. Your stomach's job is to take proteins and break them into amino acids. The amino acid tryptophan becomes something called serotonin in your brain. Serotonin is a chemical in your brain that helps you calm down. Serotonin becomes melatonin, which helps you sleep. So if you're not digesting your food properly, acid reflux, heartburn, burping, gas, bloating, chronic cough, the acid is coming up into your throat, you have to manually, you can't, but we can, manually pull your stomach down away from your diaphragm so that your stomach is digesting food properly so you can produce melatonin so you can sleep. So wrap it up, Ricardo, is this. You really got to take care of yourself. Stay away from the bad foods. Eat a lot of fruits, vegetables, nuts, and seeds, at least Dr. Joe's Super Greens and Essential Source, and make the room totally dark.
All right. Thank you.
All right, my pleasure. Thanks for calling. I appreciate that. Now, that's a real common question, actually, and that's something we have to be careful with because if we are working the night shift, we don't want to shorten our life expectancy just because we're working. Ryan, how can we make your day better?
Yes, sir. I've been having heart palpitations. They just started, I would say, about a couple months ago.
Uh-huh.
I'm trying to get some good advice. I've been looking on, several different MD websites. And some people have been telling me that it could be due to a back injury or pinched nerve.
Yes, absolutely.
I do have several back injuries from my military service.
Oh, yeah.
I just trying to figure out the next course of action, really. What should I do? Could be some things at home I could do.
Okay. Great question, actually.
I've cut out caffeine. It seemed to help at first, but everything that it told me that could be triggering it, I cut it out, and it's still happening.
Right. Okay, a couple of things. It sounds like you've done a lot of homework already, which is great. Makes my job easier. Do you have any acid reflux or heartburn, burping, gas, bloating?
I do, actually.
Okay. The reason I asked that is I had heart palpitations for years. Couldn't figure out what it was. Been to the medical route. Nobody could figure it out. Everything tested fine. My stomach was pushing up against my diaphragm. Now, the same nerve that controls the stomach also has some control over the heart, called the vagus nerve, V-A-G-U-S. And when the vagus nerve gets irritated, it can send an impulse over to the heart, and it was causing my heart to beat totally irregularly. It'd be fast, it'd be slow, it'd skip a couple of beats. And so when I finally got my stomach pulled down away from my diaphragm, my heart went back to perfectly normal. So you may have a digestive problem irritating the vagus nerve, causing the heart palpitations.
What's funny about that is normally when the heart palpitations start is when I sit down.
There you go.
And the other times is after I get done eating or something like that. So I guess what should I do now, knowing that information?
Well, the best thing to do, probably come see one of us. We have offices across the Atlanta area, and come on in, let us take a look at it, because we have one down by you, as a matter of fact. Because if the stomach is up against the diaphragm, the only thing I found, and I've tried everything because I have the same problem you do, is manually we got to pull the stomach away from the diaphragm, and like you said earlier, it could be a pinched nerve from the spine going to the heart or another organ. So we would check your spine to make sure there's no misalignments. We'd pull the stomach away from the diaphragm, and that should fix it, because you've tried everything else, and we know what it's not. We have to find out what it is.
Yes, sir.
And hopefully that'll fix it. If not, there's other places we can send you, but most people get pretty good results with this condition at our offices.
Okay.
Okay? So just give us a call,
Perfect.
and you
I
call 844-44 Dr. Joe. We can get you set up.
All right, that is perfect. Thank you, sir.
I appreciate it. Yeah, and folks, when I'm on the air, of course, that number comes to the studio. If I'm not on the air, 844-44 Dr. Joe goes right into my office. And if you have questions, even if you're not in the listening area, if you're outside the Atlanta area, the radio show, of course, goes all over the world. And so if you're outside the area, you can always give us a call, and maybe we can do phone consultations. I've done Skype consultations already. We want to be your doctor. We really do. And we want to help you any way we can, because so many times people suffer needlessly and they don't get the problem ever fixed. And when they finally come to us, the biggest complaint by far Why didn't I do this sooner? Why did I suffer so long? And I don't have an answer for that. I don't know. But from a nutrition standpoint, I recommend, of course, Super Green's an essential source. Get your diet straightened out. And on my website, we have a videotape, a lot of my lectures. So go to my YouTube channel. We have a lot of good videos there. And pick a topic that might interest you. And you can watch lectures. Because so many people are visual learners, but they don't know that. And if you learn better from watching, we have the videos. If you listen, we have the audios. My books are available there. The Super Greens, the essential source. Send me questions. We want to do everything we can to help you any way we possibly can. Folks, got to go to a break. If you have a healthcare question, give us a call, 844-44-DR-JOE. My website, again, drjoeesposito.com. When we come back, we're going to talk about other reasons you burned out. We're going to give you some questions. Do you have adrenal problems or do you have thyroid problems? Could be a thyroid problem, and it's undiagnosed. Hey, don't go anywhere. Give us a call, 844-44-DR-JOE with your questions. We're going to be right back. We're going to be right back. Hey, everybody. Thanks for being here today. I appreciate your time. And we're talking today, or asking a question, actually, are you burned out? Have you just exhausted yourself? And some signs and symptoms you may be having and not even realize that you're exhausted. So many times we just kind of muscle through the day and go, oh, today was just a bad day. Or, well, gosh, I didn't have a lot of sleep this weekend. Or I had company in town. And you just keep putting it off until you finally get to the point where your body really is just burned out. And that's a real dangerous place to be. So we're going to talk a few more symptoms you may be having. We're going to take a few more callers at 844-44-DR-JOE, 844-44-DR-JOE. And then I want to go over some symptoms you may be having. Could be adrenal glands, could be thyroid. So many people have thyroid problems and don't know it, so we're going to talk about that too. So keep listening on that. One of the things that happens, and I've seen this frequently, is you stand up quickly and you get lightheaded. There's a word for that. It's called postural hypotension. And hypo is low blood pressure. And when you stand up, postural meaning you stand up, the body has to kick in and pump the blood up to the brain because now you have gravity pulling it down. And if you start getting lightheaded or dizzy, it could be an adrenal problem. Another symptom you might want to consider is if you have bags under your eyes. Bags under your eyes could be a sign of adrenal fatigue. And the adrenal glands produce adrenaline, which gives you energy, but also helps the immune system and helps produce sex hormones. It fights inflammation, actually produces and fights inflammation. So you got to keep the adrenal glands as healthy as they possibly can be. And many times that's why we're fatigued. I said earlier, Ben called earlier, and he had asked about his pregnant wife. And one thing I wanted to make sure we discussed was that I don't want you being dehydrated. When you were a baby, there was a part of your brain that controlled hunger and a part of your brain that controlled thirst. And as we get older, those two parts of the brain grow together. That's why if you're ever around an infant, you always had to bring your sippy cup, right? I want to drink, I want to drink, I want to drink. And as we get older, we don't get thirsty like we used to. The reason is we keep thinking we're hungry when in reality we're thirsty. So a little trick I like to use, because I was extremely overweight when I was a child, and I still struggle every now and then. If I start putting on a few pounds, I got to get them off, is make sure you have a big glass of water before every meal. Give it about 10 or 15 minutes before a meal. You'll be amazed how much less food you eat. I cover that in my new book, Prescription for Extreme Health, which is on my website, drjoeesposito.com. But make sure you're getting enough water in there, because that can be an issue. But if you're getting a lightheadedness, you might want to consider adrenal issues. And we can do a saliva test in our office to test your cortisol levels, which can test your adrenal function. Brain fog is another one. Excessive stress can lead you to weird thinking and foggy memory. And if you're having brain fog, again, every now and then it's going to happen to us, but brain fog can be a big issue. And blood sugar swings. Chronic stress can wreak havoc on your blood sugar balance. It causes you to have energy highs and lows throughout the day. That can be a sign of adrenal issues. And I have that periodically in my life, where suddenly I'm just crashing in the middle of the day. I have to have a snack. I'll go ahead and check my adrenal glands. And there's actually a test we can do in our office. It's called applied kinesiology to test adrenals. And my doctors and I can check you, or we check each other. And if the adrenals are burned out, might have been a stressful day or something, there's supplements I take. One of them is called Eleuthero. Another is called Withenia. There's other ones as well, but those are the two I take. And I take them quite often because it really helps build up my adrenal glands, which can help the sex hormones, keep the cortisol at bay, help with inflammation. It's really some good stuff there. Going to go back to the callers. If you have a question, 844-44-DR-JOE, 844-44-DR-JOE. Rudy, how can we make your day better? You there, Rudy? Hello? I hear you breathing. Yes? No? Going once? Going twice? I'll put you on hold, actually, because I can read your question. All right, Rudy's question was his father has had back pains. Let's talk about that, because that's actually a good point, and it's a lot more than just pain. Because if you have pain, it tells you something's wrong. Pain is a warning sign. So if you have neck pain, back pain, shoulder pain, numbness, tingling, I want you to consider that a warning sign. I would consider it right up there with high blood pressure as a sign that something's wrong. Because the high blood pressure isn't going to kill you. It's what the high blood pressure is going to do to you that can cause some serious problems. So if you're having neck pain or back pain, that's a sign that something's wrong. So consider that. Now, what can cause pain? Usually it's a pinched nerve. Put the bones that are out of place, pinching the nerves back in place, and the pain goes away. So step number 1, we check for pain. 90% of your nerves don't feel pain. So you can have a pinched nerve and not know it. And that's why in our offices, we check the nerves that feel pain and we check the nerves that don't feel pain. So back pain is usually due to bones out of place. The easiest thing to do is put the bones back in place. And if we can put the bones back in place, you feel better, open up nerves to organs, and the spine doesn't wear out either. So if somebody's suffering pain, the first thing I want to look at is what's causing the pain. Then we look at their diet. We say, okay, are you eating something that's causing inflammation? I know I can't eat caffeine, for example. If I do caffeine, I get headaches. And then if we do need supplements, I put people on a supplement protocol. Most people I put on Super Greens and Essential Source because that's the basics that everybody should be taking every single day. You know, everybody looks for a quick, easy, cheap fix on healthcare. That's your stepping stone. That's the way to break into healthcare, Super Greens and Essential Source. Rudy, you there now, Rudy?
Hello.
Hi. Okay, you're back. Did I answer your question?
Right. Oh, I'm so sorry.
Okay.
I had to close my gate because we were holding on for a long time.
Okay.
But yeah, my husband has pain protruding down from the left side of his neck.
All right. Rudy, guess what? I got to go to a break. Can you hold on? I'll get you right after the break, okay? Hold on one second. Folks, if you have a question, 844-44-Dr. Joe, my website, drjoeesposito.com. Great place for books, supplements. Send me questions, read my articles, watch videos. Really good source of information, drjoeesposito.com. Hey, don't go anywhere. We're going to be right back. Hey, everybody. Thanks for being here. I appreciate it. And we had, let's see, Ruby, you still there for me?
Yes, hi.
Okay.
I'm still here.
All right, Rudy. Yes.
For your break. Yes, anyway, the pain is from the left side of the neck all the way down the back. And when it starts, if he lays down, it gets worse. Once he stands up, the pain eases, and then he has to lean his head on the right side to ease the pain on the left.
Understood.
And it protrudes down the middle of his back and into his chest.
Yeah.
The left side of his chest.
Yeah, the fact that it changes when he changes position sounds to me like it's a pinched nerve. And what you need...
Sounds like a pinched nerve.
It sounds like a pinched nerve. Now, again, if he's having heart palpitations, blood pressure issues, of course, we want to get that checked from a medical expert.
His chest hurts enough right where his heart is.
Okay, have we had any tests done on that?
Beg your pardon?
Has he had any tests done? Has he been to his medical doctor?
No, we haven't been to any doctor because we don't have any insurance. So
I understand, sure. Well, it could be a pinched nerve, but if that chest pain continues or shooting pain down the left arm, you definitely want to get to a medical expert, get to an emergency room if you need to, and get that checked just to make sure it's not a heart condition.
Exactly.
Okay.
And then again, he has a tooth that's on the left side of his jaw that's really been hurting him for about a month now, and it's the pain. It's probably, we thought it was the tooth that was causing the pain to go down his neck.
It could be, but whenever I start seeing left arm pain and chest pain, I always want to get that checked just to be safe. And I would get that checked, and then if it's not a heart issue, then you can come see us. We'll take a look at it and see what else it could be.
Are you in Atlanta?
Yeah, we have offices in Marietta, Duluth, and Stockbridge.
Marietta and Stockbridge. Well, we're in Douglasville, so it's easy for me to get to you.
Perfect. If you just call the number 844-44-Dr. Joe, when I'm not on the air, we can go ahead and get you set up an appointment.
Nothing to do with it. The tooth has nothing to do with it.
It could, but I'm just worried about the heart. I want to make sure it's not a heart issue. Okay?
Yes.
Thanks so much, Rudy. I appreciate it. And folks, if you do have a question, 844-44-Dr. Joe. Let's keep going with the questions. Jonathan, how can we make your day better?
Hey, Dr. Joe, how you doing?
I'm very good, thank you.
Awesome. So I have a heart condition called aortic stenosis with a bicuspid aortic valve.
Sure.
And I go to the cardiologist every year, and he says I'll be fine until I'm 80 or whatever.
Right.
However, it's in the last 5 years caused a lot of anxiety.
Yes.
Like at some points, debilitating anxiety. And on top of that, so I dip, I like beer, and I'm wondering if those things, along with adrenal issues, can feed the anxiety, and what can I do nutritionally or chiropractically to help resolve some of the anxiety
Right.
or some of the little pings and pains and stuff.
Well, the anxiety is normal because when the body senses something wrong with the heart, the body goes into an anxiety issue, saying, "Hey, something's wrong here. Fix me. Don't ignore this." So whenever we have a heart issue, anxiety is a real common symptom. So we want to check that. Now, from a chiropractic standpoint, I would check the nerves in the lower part of the neck and the upper part of your back. Those are the nerves that control the heart and the lungs, so that can affect breathing as well. If you do have any acid reflux or heartburn, I'd recommend that we talk about that a lot, pulling the stomach away from the diaphragm. Giving up the chew is going to be huge because the nicotine is a stimulant. And if your heart's already under stress and then you're giving it a stimulant like caffeine or cocaine or, the body's going to go into more stress. Say, hey, dude, don't do that no more. We don't like being stressed out. So I know it's tough to give up the chewing tobacco, but it's going to be vital for your health, regardless of whether it's a heart condition or not. It's creating a major chemical stress on the body.
Right.
Okay, so I would definitely do everything we can to give that up. Make sure you're getting enough water in. I would check the nerves in the neck just to make sure there are no pinched nerves going to the heart. And from that point, Super Green's an essential source. Again, I sound like a broken record, but those are two supplements I think everybody should be taking. And then other supplements, if it is an adrenal issue, it depends. If you eat meat, I would put you on Drenamin, which has animal products in it. If you don't eat meat, we have other products, Withenia, Eleuthero, and those are supplements we have at my office that I give to a lot of my patients, and I take actually Withenia and Eleuthero every day.
Okay.
Okay, so that's a good start.
Okay. Well, I do appreciate it, and I'll give you guys a call tomorrow.
Thanks, Jonathan. I appreciate it. All right, let's keep the calls going. Jim, how can we make your day better?
Yes, sir. How you doing there, Dr. Joe?
Very good.
I wanted to ask you about those two supplements that you just mentioned again. I couldn't write them down fast enough. Could you spell them for me, please?
Yes, Eleuthero, ELEUTHERO. I think that's right. And Withenia.
Eleuthero?
Eleuthero, yes. And the other one is Withenia. Okay, WITH.
WITH.
TH.
Okay.
With the NIA, I think it is. If you Google either one of them, it's going to come up with the right spelling. So.
Oh, okay. Now those supplements more or less help with the bags under the eyes.
Well, it's going to help the adrenals, right? And if it's an adrenal issue, the bags under the eyes, the fatigue, the postural hypotension, standing up and getting dizzy, those are all adrenal signs. Low blood pressure. And so we would go ahead and get somebody on that. Now, if you want to order them, we can get them for you as well. We have them at our office as well.
Okay, I'm going to do that. I'll have to do that, okay?
Great, Jim. I appreciate the call. Thanks so much. Folks, if you do have a healthcare question, 844-44-Dr. Joe. As we keep the calls going. Nikki, how can we make your day better?
Hey, thanks for taking my call.
You're welcome.
I actually, this is kind of a two-part question. When I was little, I was diagnosed with a heart murmur. As a result, whenever I would go to the dentist, I would pre-medicate. And maybe a couple of years ago, the dentist eventually says, "Oh, hey, we don't have to call in an RX for you to pre-medicate. That's done now, so you can just come in." I did go in a couple of times, so it just made me nervous. And I did research regarding why versus why not. And he just says, "Well, if you want to take them, you can, but you don't have to now." What changed that we no longer have to pre-medicate? That's part one of that same question.
Okay. Well, the reason they would pre-medicate is because the same membrane that covers your teeth also covers your heart.
Okay.
And if you have an infection in your teeth, it can get into that membrane, travel down into the heart, and can cause serious heart problems. My father had rheumatic fever as a child, and because of that, he had a mitral valve prolapse, weakened heart from it. So he always had to pre-medicate before he went to the dentist. And if he had an infection, of course, we had to deal with that. Why the dentist said not to do it anymore, I don't know that answer. That's I have no idea what his thought process was on that.
Okay, then I'll go back to pre-medicating, because I actually stopped and went to just have a regular cleaning, and I asked him, and he just says, well, yeah, the medical association just said it wasn't necessary.
Yeah, if there's a change in a protocol, that could be the change in a protocol, and then I would follow what he's saying. Sure.
Right, but again, he gave me the option, but I just couldn't get a clear enough answer.
Right.
So I just wanted to throw it by you. Now, part of that, one day around my heart area, I felt a really sharp pain a few times. It wasn't gas. And I think one time I was driving, and I almost felt as if someone had taken a hot poker and shoved it in the back by my scapula on my left side.
Right.
It took it about
okay.
maybe
Nick,
20 minutes.
Got to go to a break. Can you hold on 1 second for me? Folks, if you have a healthcare question, 844-44 Dr. Joe. My website, if you want to make an appointment, either in person or on the phone. If you want to get Super Greens, Essential Source, my books, my supplements. If you want to read articles, listen to archive radio shows, the website's there 24 hours a day, 7 days a week, and it's my present to you. It's no charge. So the website is drjoeesposito.com, or just Google Dr. Joe. We'll be right back. Google Dr. Joe. I am very happy that you're here today. Hope you're having a great day. We're talking today, or answering the question, are you burned out? Are you totally fatigued? Before we go back to that, we had Nikki on hold. Nikki, you still there?
Yes, I'm still here.
Okay, so go ahead. Your question.
Okay, my other question was, one day I just felt I had a sharp pain in my heart, but I also felt at the same time that someone had taken a hot rod or something and stuck it right behind my scapula on my left side. It just felt as if somebody had taken my heart and just ripped it in half. So I almost felt incapacitated for at least 10 minutes and had to pull over on the side of the road and was contemplating taking myself to emergency. Do you have any idea what that could have been?
It was on the left side or the right side?
On the left side.
On the left side. Okay. It could have been the heart.
And it had not happened then.
Yeah, it could have been the heart. Sometimes you get blocked blood vessels in the heart, and you get some severe pain in there. Now, the body has what's called collateral circulation. So if one blood vessel is blocked, the body instantly starts to circulate around that area, or it could have been a clog that was there for a second and kind of got flushed out. It could have also been something as simple as a pinched nerve. I have patients come in all the time with pain in the mid-back, and you got your ribs and your vertebrae all kind of coming together in the mid-back. And if those ribs come out of place, and I've had that happen too, you can't get your breath. It hurts like heck. You just it feels like a knife going in there. So it could have been just simply a rib out of place as well. But when it comes to heart things, a lot of heart issues today, I would recommend you always get evaluated. Get it checked out just to make sure it's not the heart. If it's not the heart, then we got to look at, is it a stomach pushing up against the diaphragm? Is it a pinched nerve? Is it a rib out of place? And then we got to approach it from the physical aspects.
Understood.
Okay.
Understood. Absolutely a pleasure. Thank you so very much.
Well, thanks, Nikki. I appreciate your call. Have a great day. All right. Let's see here. I can't see your name. Who's this? Hello?
Hello?
Yes. Who's this?
Jay.
Hey, Jay. Dr. Joe here. I'm sorry. I couldn't read your name on the screen. How can we make your day better today?
A thing happened to me a long time ago. I took one of those pills that kind of jack up your heart rate.
Okay.
And I was doing some work, and I think I noticed my heart rate just really shot up, and I was kind of feeling it, like my blood pressure went up, and I think some anxiety kicked in. And what happened is my left arm just went completely cold. I mean, just like I actually called an ambulance because I thought I was going to have a heart attack, and they came to the EKG, and then it was fine. They said my heart was fine, and then since then, it's weird. It's like my left arm and my left leg have these weird burning, deadening pains, mostly in my left arm and my left leg.
Okay.
And it's mostly after some type of exercise. I'm a cyclist, a runner, and I play tennis and stuff like that. So I don't know what it is. Like sometimes my foot feels like I'm wearing like a wet sock.
Sure. Well, what you just said it right there. If you're a cyclist, that position that you're in when you're cycling takes the whole shoulder girdle, the ribs and everything, and slams it up into the spine. I have an old injury on my left side as well, and I even something as simple as washing windows. If I'm raising my arm up for too long a time, it flares up. So it sounds like the cycling issue could be the pinched nerve. Now, you had the EKG, so we know it's not a heart attack, right?
Well, they said it wasn't. I think it was the anxiety that kicked in and kind of made it feel like it was worse than it was. But It's weird when the ambulance got there, my heart rate went back to normal. They did the EKG. They said my heart was fine.
Okay, good. So if you know the heart is fine, then you want to start looking at the structural issues. And I treat a lot of bikers, professional and amateur, and that position that you're in just jams everything up at the base of the neck area. So I would consider that it's probably a pinched nerve going into the arm, and then also cycling, it goes into the leg. And the way the body works, this is kind of like a little advanced neurology here, is the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. So most people have issues on one side of the body because it goes up into the brain, and then the brain sends messages back down. And so one injury on one side of the body could lead to a malfunction in the brain, causing other symptoms to show up on that side of the body. So it's pretty classic to have your symptoms on one side.
Yeah, and also, too, I have seen a chiropractor for numerous years. Actually, I went to a chiropractor. I know I do have, I think it's called cervical lordosis. My neck is straight and it's slanted forward, and I have some slight subluxation between my C1 and my C2.
Yeah, so you already know you have that already, and then you're cycling. So it sounds like that's the direction I would pursue, is getting it structurally corrected.
Yeah, what's the best method for that, I guess?
There's several different types of chiropractic methods. In my offices, all my doctors are trained in multiple methods because sometimes we have somebody we can't manually adjust. We have to use something called an activator, a drop table, or a flexion table. So all my doctors are trained in multiple techniques to see what the patient needs. We then incorporate that technique for that patient.
Okay, so y'all do a lot of work with upper cervical.
Oh, yeah. We don't do just upper cervical. We do the whole body, but absolutely the upper cervical is included in that, yes.
Okay, great. That sounds like it's exactly what I need.
There you go. If you want to give us a call when I'm not on the air, 844-44-Dr. Joe, and we'll get you set up.
Excellent. Thank you very much.
I appreciate the call. Let's take a call off Facebook. Somebody sent me a question on Facebook. And Ken wants to know, are Super Greens and Essential Source available on Amazon? The answer is yes. We do have my Super Greens and Essential Source and other supplements are available on Amazon. So if you have an Amazon account, then it might be just easier for you to do it that way. And by the way, like me on Facebook or follow me on Facebook, Facebook.com/Dr. Joe Esposito. And we send out some good information on Facebook as well. If you want to sign up for our newsletter, you can go to my website. We send out, very seldom do we send out a newsletter, but when we do, it's brief. I don't like these long, drawn-out newsletters. They drive me crazy. All right, so we're talking today about are you just burned out? Are you just wiped out and fatigued, and what do you do about it? Do you have reliance on coffee or caffeine or sugar to get through the day? Caffeine and sugar, they'll boost your energy levels. We talked earlier, it really doesn't give you energy. It actually just prevents you from getting tired. But that could be a sign that our natural energy reserves have just been burned out. And it's hard to come off coffee. I know that. And like I said earlier, in my first book, Eating Right for the Health of It, we have a way to do that, to get off your coffee. Put a cup of coffee in front of you and drink 1 tablespoon of coffee every hour. And after about 2 or 3 days, you should be able to get off your coffee. Fellas, got to go to break. If you have a healthcare question, 844-44-Dr. Joe. If you don't get through, that's the number to my offices as well, and you can call that number if we're not on the air, 844-44-Dr. Joe. And my website, if you want to order products or supplements, read articles, drjoeesposito.com, or just Google Dr. Joe with the number one Dr. Joe in the world. We'll be right back. Dr. Joe. Hello, everyone. Glad you could be here today. Hope everybody's having a good day and trying to teach you a few things, trying to teach you what happens when your body burns out, and what that really means, and things you need to do to fix it. You need to fix the structural issues, pinched nerves, because nerves control organs. So if you have a pinched nerve to your adrenal glands, your heart, your stomach, your kidneys, you got to get that fixed. And that's why chiropractic becomes so important as part of your healthcare plan. You want to fix the chemical issues, what you're eating, stay away from the bad stuff and eating the good stuff. And then you want to make sure you have a good digestive system so you can absorb your nutrients and pass out your waste products like you're supposed to. And so I'm going to take a caller. Then we're going to give you, I promised you earlier, I'm going to go comparison between adrenal problems and thyroid problems. So, Jeff, how can we make your day better?
Hi, Dr. Joe. I'm prone to gout. I had originally the kind that makes your foot swell, and I have the kind that now instead of your foot swelling, your joints hurt if you get it.
Sure.
And I manage it with allopurinol and with diet.
Sure.
A lot of the things that are good to eat, I can have if I just watch the quantity, like turkey and legumes and salmon. But one leaf of kale, and I'm gone, for example.
Wow.
So I was wondering about your supplement, whether it contains the purines that are such a problem for me.
I've never had a problem with a patient having gout taking the supplements. So I've never seen that happen in all the years we've been doing this. That being said, I don't know if you would or not. So what I usually tell people if there's a question is take a teaspoon, of Super Greens, and then the next day take a teaspoon of Essential Source and see if there's any reaction. If there's no reaction, then double it to a tablespoon and then go up to a scoop. And I've never had anyone have a problem with it, but again, I'm not saying you wouldn't be the first one. But I would try them separately because if you mix them together, you don't know which one if you are having a reaction. And if you are having a reaction, you can give the product to anybody. Most people would love to get that as a gift, so you can share it with your friends, your family, or something like that. But when it comes to gout, a lot of doctors don't tell you this. You got to stay away from high fructose corn syrup because high fructose high fructose corn syrup converts into uric acid. The fructose converts into uric acid, and uric acid is what causes the gout issues. Now, uric acid prevents the body from producing nitric oxide. Nitric oxide opens up your blood vessels and allows good circulation to your brain, your sex organs, your arms, your legs, and it also helps flush out the joints that are having a lot of the pain. So you got to be real careful to stay away from fructose and high fructose corn syrup if you're prone to gout because of that problem.
That's really good to know. Thank you.
All right, Jeff. Thanks for calling. I do appreciate it. Yeah, and that's why you listen to this show, folks, because a lot of times, and again, most doctors are brilliant at what they do, but they don't do the holistic approach. Like a cardiologist is really good at heart, and kidney doctor is really good at kidneys. And I refer to doctors all day, every day, medical doctors, psychiatrists, other chiropractors, orthopedists, and they refer back to us because I like working with doctors that have an open mind and say, I can't fix everything, and I can't fix everything. My team of doctors come to me almost every day. Hey, doc, what do you think about this patient? Should we refer him out? Yeah, let's get an evaluation on this. Let's get an MRI. Let's get a CAT scan. Let's get a cardiology workup. Or, no, let's try this first and see if this works, and we can always refer him out later. So I like working with people that are open-minded and understand that there are other ways to fix things, not only, my way or the highway. We're talking about when you burn out, when your body is just exhausted, and it could be an adrenal issue. Now, if it's adrenal issues, you could wake up at midnight or after. You're not sleeping through the night. You start to crave salt or sugar because many times the body is craving the salt, needs the electrolytes. If you're going to do salt, it's got to be air-dried sea salt. Do not under any circumstances use table salt. It's junk. Air-dried sea salt, good for you. Table salt, white salt, bad for you. Adrenal signs could also be generally exhausted after exercising. You work out, you're just wiped out. And also you're intolerant to heat. You just can't take the heat. Thyroid problems can also cause fatigue, but you might sleep too long. Adrenal people wake up early. Can't get through a whole night's sleep. Thyroid people sleep too much. Thyroid people usually crave carbohydrates and fats if you have a thyroid issue. You feel better after exercise, and you can't tolerate the cold. So many times you don't know which one it is. Is it thyroid? Is it adrenal? Well, now we have a way to help you out there. Now, of course, we can do testing for this as well in my offices, but this is kind of a good thing. Intolerable to heat, adrenal, can't tolerate cold, thyroid problems. Waking up in the middle of the night, adrenal. Sleeping too much, thyroid. Following along? So hypoadrenal, meaning low adrenal, when the adrenals aren't working. Fatigue, of course, is the number one symptom. We talked about premenstrual issues, mental depression, inability to concentrate, craving sweets and salts, allergies, apprehension, headaches, alcohol intolerance. These are all signs the adrenals are not working as well as they should. And that's a lot of these conditions I have. Like, I can't drink. It's not that I like the taste of alcohol. Last time I had it was decades ago. But even just a little bit of alcohol, I just don't feel good. So it could be a sign, someone like me, with adrenal issues. And I did have adrenal issues for years. I had horrible allergies. And so I fixed them, taking supplements, and I still take supplements. But another thing with adrenal issues and thyroid issues, I want you to consider, is there a pinched nerve involved? For the thyroid, it would be the fourth cervical nerve, about the middle of the neck. So middle of the neck is the nerve supply directly into the thyroid. So pinched nerves in the neck can affect the thyroid. The adrenal glands, for women, it's like right below your bra strap. That area there, that's the nerve supply that controls the kidneys and the adrenal glands. And so if you have chronic pain in that area, you could be pinching the nerve to the adrenals as well. And taking supplements would help, but it's probably not going to fix it. That's why chiropractic ties in so beautifully when it comes to putting together a healthcare plan. Get the nervous system working. Check the digestive system. Get the diet straightened out. Get on supplements if you need to. Like I said, everyone, unless you're on blood thinners, you can call my office and we can talk about that. But Super Greens and Essential Source are just spectacular. They're great for kids. It's great for adults. It's great for any age. They taste good. I mix a scoop of each. I take it with coconut milk or almond milk and shake it up and drink it. You can put a frozen banana in there and make a smoothie out of it. But when you start giving your body the minimum amount of nutrients, like Super Greens and Essential Source, most people just are like out of their minds. Oh my gosh, I can't believe this is so good. All right, let's go back. We talked about adrenal glands, thyroid problems, low sex drive, heavy menstrual cycle, depression, mental slowness, craving of carbohydrates. We talked about that. A deep, monotonous voice. Many times you'll find people with thyroid problems talk like this. A dull, expressionless look on their face. They're just not excited about life. Of course, the swelling of the glands, the goiter, and then constipation. Constipation could be a sign of a thyroid problem. Now, any of these symptoms don't necessarily mean you have adrenal problems or thyroid problems. But it's, okay, I got a bunch of these symptoms. Maybe it's something I want to consider. And you can do blood work for both of them. We can do tests in our office as well. Folks, got to go. Thanks for listening. If you want to order my books, if you want to get supplements, if you have questions you didn't get on the air today, give me a call at my office. My office number is 844-44-Dr. Joe, DRJOE. My website, if you want to order supplements, books, send me questions, read articles I've written, drjoeesposito.com. You can just Google Dr. Joe. Because of you, we're the #1 Dr. Joe in the world. Hey, thanks so much for taking your time to be with me today. Tell your friends about the show. We'll catch you next time.